Good afternoon. My name is Marc Arnold. I'm a nurse practitioner here at Bon Secours Cardiology, and I'd like to discuss with you today a new and innovative way for delivering healthcare via telemedicine. It's an app from Bon Secours called Bon Secours 24/7. This is a unique opportunity for patients and providers to come together as one in order to conduct healthcare visits at the comfort of either your home, your office, or wherever it is you may be, in order to obtain health care without the hassle of having to take time off from work or at off hours having to come into our office. So Bon Secours 24/7 can be used for a variety of ailments, typically for primary care, where we're looking at ear infections, eye infections, routine non-emergent medical care that could be conducted via a video and voice conferencing similar to what we're doing on Facebook today, that is done over an app which the patient can download to their computer or phone. So my experience with Bon Secours 24/7 is a little bit unique. We've taken this technology and enhanced our services to our patients with congestive heart failure. So my patients who have been admitted for congestive heart failure are discharged home, and without having to have them come out of their home on a regular basis during the first 90 days after they've been admitted for heart failure, I'm able to follow patients from their own home to monitor, assess their situation, see if they're developing any symptoms, because the goal of our program is to treat patients at home and prevent readmissions into the hospital for the same symptoms. So other conditions that are being used in specialty care for Bon Secours beyond heart failure is also our surgical program, where patients who have undergone some bariatric surgery or other surgical interventions where a post-op visit is needed just to assess symptoms, also assess the surgical site, can be done in this manner instead of having the patient take a significant portion out of their day, having to drive to an office, wait in a waiting room, and wait for a provider. And additionally, using this kind of platform, my patients like the ability that, again, they don't have to travel to my office, but if I am running slightly behind schedule, they're not waiting on me. We can certainly communicate that a visit may take place a little bit later than scheduled. We can certainly reschedule, or we can use this service on typical off hours or on weekend to follow up on patient care. So a lot of questions are arising. What kind of patient examination can be done via telemedicine? Now, with telemedicine, we're able to, again, visually look at the patient, where a picture is worth 1,000 words. Moving video and audio is priceless. We can do assessments on wounds. We can do assessments on any visible condition. Simply talking to the patient, seeing their effort of breathing. Patients who have home monitoring devices such as blood pressure, pulse oximeters are able to share that information to us, so we can have an accurate picture of how their condition is at home. So in my clinic, I am using your chart, or what's called my chart for the patients, which is the Epic Connect Care chart that patients have within the Bon Secours system. So it's a seamless integration of a healthcare provider, the patient, and the medical record, so we are all on the same page. It's been difficult for patients who use multiple services to have to remember their medical conditions, remember their medications, and by allowing access and us using your dedicated My Chart, it allows us to have all that information in front of us and prevent the chance of a medication interaction, and all providers within the Bon Secours network know what other providers have done, what medicine changes have occurred, and what the patient's condition is.
Will my primary care provider get a report of what you've seen at 24/7?
Yes, at the end of the visit, I will send the patient's primary care providers, and also, depending the patient's cardiologist, a follow-up note about our visit, any medicine changes, and what our future plans are for additional visits, whether I need to do it on site or it could be done again via video conferencing.
Are you able to order additional testing if you need to confirm a new diagnosis or check on how a medication is interacting with my organs, etc.?
Certainly. So again, using the patient's chart, I'm able to order specifically what I use in cardiology, x-rays, laboratory work, particular ultrasounds for heart failure patients in order to reassess their symptoms or to see their progress of treatment that we've started here.
Will this replace all of my on-site visits to a medical office?
This will not. This is used as a supplement, or what we use in telemedicine is called a hybrid approach, where patients are seen both on-site and online for interactive care. So there's certain hands-on approach procedures, techniques, examinations that I need to be able to directly listen with a stethoscope or palpate with my hands, and others are just simply with minimal assessment skills that the patient can help me with over the video, such as if I want to look at their legs, if there's any degree of swelling, see if there's any medication interaction side effects, or even use this as a follow-up visit from a in-office visit to see the response to a medication or that the condition I saw you for is improving.
Can I get prescriptions to my regular pharmacy?
Absolutely. The prescriptions that we use are sent electronically to your pharmacy. Typically by the end of the visit, the prescriptions are sent, and the duration is however long it takes your pharmacist to fill the prescription. With the innovative aspect of Connect Care, we're able to immediately send prescriptions, and patients are no longer waiting on providers to co-sign or write prescriptions anymore.
Do I need an appointment for 24/7 for every condition?
For every condition, no. Bon Secours 24/7 is open for patients of both Bon Secours and non-Bon Secours. Of course, we hope that you, after this service, become a Bon Secours patient, but it allows you to, at any time, anywhere where you have a mobile device or a laptop computer, that you can access Bon Secours 24/7 for primary care based services. Again, that's more for your colds, cough, congestion, ear infection, eye infection. Flu-like symptoms was quite prevalent with the flu epidemic we had during this winter season. For specialty care like myself and surgery, we do schedule appointments in Bon Secours 24/7. So once I schedule an appointment for a patient, they are sent an email with a link, and all that's required is the patient simply click on the link to open up the visit, and off we go.
What equipment do I need to run Bon Secours 24/7? Can I use my computer, my phone?
So there's several different devices that you can use to access Bon Secours 24/7. Most common is a smartphone where patients are downloading an app. The other is a tablet or a computer that has a built-in camera, typically a laptop, or a desktop that has a standard external camera and microphone.
How do I sign up for Bon Secours 24/7?
So to sign up for Bon Secours 24/7 is easy. You can go to bonsecours247.org and follow the instructions on how to download the app, or for further information, you can call 855-247-2990. And again, that phone number will be available on the app page or the home page for Bon Secours 24/7.
How much does it cost, and how do I pay for it?
So for patients who are going to access the service, the cost is $49 per visit. Again, that's for your primary care type visit. For specialty care in cardiology, it is inclusive in what we call a Medicare bundle patient. So for patients who are admitted and discharged from the hospital with congestive heart failure, Medicare patients, they are placed in what we call a Medicare bundle. So for the first 90 days, we are responsible to keep an extremely close eye on these patients with myself, nurse navigators, physicians, and other providers within the office in order to maintain that patient's optimal health at home, prevent readmission, and to address symptoms and concerns much sooner than conventional methods. So there is no additional cost for these patients to have this kind of service. Again, we want to make sure that the patient stays at home, is not readmitted, and patients feel the same way, that they prefer to stay at home and treated at home without the need to be bouncing back and forth between the emergency room or other healthcare facilities.
Thank you. Do you have anything else to add?
As far as adding Bon Secours 24/7, the hospital system has done a great service to the patients by allowing specialty service to branch out and use this version of healthcare. Initially, when it is direct to consumer, it is very limited to just primary care and basic healthcare needs. But by being innovative and embracing the technology, we are now able to branch off into specialty care such as cardiology and surgery. And I'd like to see in the future services like endocrinology and pulmonary come on board in order to provide patient care, improve access to care. I find that Bon Secours 24/7 has been great for my patients who have to travel a long distance of time. Here in Richmond, Virginia, some of my patients travel greater than 80 to 90 miles from the rural regions, where now we can save on that time and hassle of travel by using this platform.